Welcome, everyone. Please feel free to introduce yourselves, who you are, what you're doing. Love to hear a little bit about what your dementia journey is. Are you a person with lived experience? Are you a person who's involved with caring for somebody, either in a family or relationship caregiving experience? Are you somebody who's professionally involved in this? Let us know who you are, where you're coming from. It's such an important thing that we actually share our stories together. The way that we're going to go through this webinar is by having an opportunity to set the stage first. Then we're going to go into the 6 key recommendations we have. We're thinking how important it is to have all of our voices, all of your voices, all of your network's voices involved to make sure that we don't forget about dementia. And when we don't forget about dementia, one of our calls to action at the end will be to make sure that we share some of our social media assets, and we'll have those for you here as available. If you have to leave earlier and you want to know where they are, you can go to the Ontario Dementia Care Alliance information on social media, or also the Alzheimer's Society of Ontario. So let's get into it now. The way that we're going to do our format is to have about 45 minutes to hear from our key experts, and then we're going to reserve a lot of questions. You can put information in the chat all the way through. You don't have to wait at any point. You can, however, if you want to make sure that you get your formal question in there, just make sure that you click the little chat button as well. So you can see that across. If you're using a computer, many of you will be very familiar with Zoom, but just to make sure that you do, there's the little bubble. That's where you can put things into the chat. That will open it up. We've got some candidates here as well. Great to have you here, candidates. Great that we have experts in as well. Keep that chat going. Exchange stories, informations, commitments. Candidates, if you're interested, share a little bit about what you're thinking about this. And then if you have very specific questions, please put those into the Q&A, which you'll see has a little question mark at the bottom. If you're a person like me who benefits from closed captions, you will see that CC sign at the bottom. You can click that and you will have closed captions across your screen. We will be recording this, the presentation component of it. So if you are concerned about that in any way, I just wanted to let you know we are going to be making sure that we're both broadcasting this live and making sure that we are sharing this information. Of course, it's really important to remember this is an information session, and we're, again, so great to see so many of our candidates here today, as well as key issues. So you will be muted and hidden because we are in a webinar format, but you can engage in the chat. Turning to our next slide, you'll see that our agenda is really kind of set the context. I'll do that really quickly. We're going to talk a little bit about who is the Alliance, why does it matter, and then we'll make sure that we get to our Q&A. So the why does it matter is really important. I tell my students I'm going to fail them if they tell me that the population is rapidly aging. We're not rapidly aging. And it's important to remember that we're aging in exactly the same way we always have been, but we really haven't built in the infrastructure that we need to deal with an aging population. And while it's true that not all dementia is experienced by older persons, we do know that the older you get, your chances of having dementia does increase. These numbers that you see here are profound. We already know that about 335,000 people in Ontario are living with dementia. Now, remember that that doesn't include the folks who have about the same amount, about 350 or so thousand with mild cognitive impairment. These are going to triple by 2050. I think it's also important to remember how many people are underdiagnosed or not diagnosed as well. So that's going to be a really important thing. We have an election. We have a snap election on February 27th. This is a great opportunity to make sure that we get our issues, which are the issues that everybody should share, onto the minds of all political parties. Let's make sure that as we move forward in our next slide, we can see that our goals are really key. We want to let you know what are all of the experts in the Ontario Dementia Care Alliance saying, who are they? And we want to make sure that we're there to provide help and support for, again, nonpartisan, but importantly, political advocacy. So who is it? It's a whole group of people. This is, again, a nonpartisan group of experts. They include all kinds of folks from across the spectrum. We have academics, we have healthcare professionals, community-based organization, people with lived experience themselves providing input, care supporters. All of these folks are being brought together with some support to make sure that we're getting the right information into the right hands to make sure that Ontario is ready to really tackle the issue of dementia at a very exciting time. We're having our brand new disease modifying treatments coming in. But unless we actually set the stage with some really important key recommendations, folks won't necessarily have the benefit of them. We want to also thank the Alzheimer's Society of Ontario, who are providing the administrative and background support. So here are some of the folks in the members of the Ontario Dementia Care Alliance, and we'll just put that up for you. We'll also share some of that information and how to get more key information for what you might need to do as well in our chat section. So we have 6 key recommendations that we're going to talk about, and we have excellent experts here to explain a little bit what's in those recommendations. What is it that we need to change? And remember, these have been validated from, very, very intense work and research and expert opinion. These are, again, nonpartisan, but utterly reliable. You'll see here information in the chat for the links about that. So I'm going to turn it over now for our first recommendation. But before we do that, Adam, do you want to pop in and just orient us to any of the key information about the Ontario Dementia Care Alliance or Alzheimer's Society Ontario before we move to our expert conversation?
Thanks very much, Laura. So good afternoon, everybody. My name is Adam Morrison, and I work at the Alzheimer's Society of Ontario with my colleague, Jessica Hogel. Her screen name there is ASIO Education because she's supporting in the background, but you'll hear from her at the end as well with resources. As we're going through, I'm going to do my best to put some resources in the chat. And just a reminder, if you have questions, you're more than welcome to put them in the Q&A. If you open your Zoom options, you should see a question mark with a box for Q&A where you can enter questions. You can also enter questions with the chat function. Those will come directly to us. We've already got about 9 or 10 questions, so we're going to do our very best to get to as many as we can, but keep those questions coming in. Yes, we will post the recording online afterwards. Yes, we will also make sure you get these resources that are going to be on screen and that I put in the chat. But Laura, I think we're probably good to go. So maybe we can go over to our colleague Kelly to introduce herself and speak to the first 2 recommendations.
All right, Kelly, you've got the stage, and anyone else who'd like to take themselves off screen will let Kelly have the full stage on the website.
Thanks so much for setting this stage, Laura and Adam. It's a pleasure to speak with everybody today. I work for Provincial Geriatrics Leadership Ontario, and this is an entity that coordinates specialized clinical services for older adults living with complex conditions like dementia. So the 1,600 plus health and social care professionals that I work with daily provide screening, assessment, intervention, and ongoing care for people living with dementia. So I'm going to speak to a couple of the recommendations. The first is recommendation 1, which includes 2 parts. The first part is to develop, implement, and fully fund a comprehensive provincial dementia care framework. And this includes meaningful targets and outcomes for patient care and care partner supports, as well as the implementation of a diagnosis pathway that can support the disease-modifying treatments for Alzheimer's disease that are on the horizon. The second part of this is to establish a leadership infrastructure that's aligned with Ontario Health and that's mandated to oversee dementia care and implement the provincial dementia care framework, including funding and quality improvement for more consistent patient care, care partner, and provider experiences. So to speak to this for a minute, the recently passed Improving Dementia Care in Ontario Act is a critical first step. And this requires the Minister of Health to develop the provincial framework for dementia care. And so we applaud this legislation, but action must follow. To be effective, the framework must be developed in consultation with people living with dementia and with care partners and health professionals that are supporting them. And just as cancer care, palliative care, and mental health and addictions have dedicated leadership structures, dementia care requires Dementia Care Ontario, so to speak, a funded leadership infrastructure to drive implementation and accountability. So a framework alone is not enough. Knowledgeable leadership is essential to move it into action and deliver real results, because that's what people living with dementia need most: action and results. I'm going to take us to our second recommendation. And so recommendation number 2 is kind of near and dear to my heart. And this is a recommendation to invest $75 million per year to ensure that all people living with or at risk for dementia in Ontario have access to team-based primary and specialist care, such that people with cognitive concerns can be assessed within 12 weeks. And this is important to ensure not only access to diagnosis, but ongoing care for complex conditions that often occur with dementia. So team-based care is the right type of care for people living with complex health conditions like dementia. And I say this from experience because I've been involved in the development of team-based models of care in both primary care settings and specialty care for the last 15 to 20 years. But wait times for dementia care are too long, and improving team-based models can enhance timely diagnosis, optimize physician time, and improve patient outcomes. We know from our colleagues in primary care that primary care physicians face challenges in providing comprehensive dementia care, making interdisciplinary teams critical for effective follow-up and support. Data also tells us that people living with dementia are already seeing physicians or primary care providers on average 12 times a year. And that's a lot to manage alone in a busy practice. So team-based care is the best approach, integrating expertise from nursing, rehabilitation, social work, pharmacology, and medicine to manage individualized needs. I'm going to pass it over to my colleague, Deb Goulet, for the next recommendation.
Thank you so much, Kelly. So I'm just going to briefly chat about the recommendation number 3, which relates to diagnostic capacity. So currently we live in a wonderful system for which many of our tests and screening tools and physician visits are covered by our provincial plan, Ontario Health Insurance Plan, OHIP. But there are elements of our healthcare that are not covered. And what we're proposing is that there's full coverage through OHIP for all of the diagnostic and laboratory tests that are required to diagnose mild cognitive impairment and dementia. Currently, the routine ones definitely are covered. There are some tests for nuanced specific types of dementia that are no longer covered. And it would be ideal if those could be covered. Right now, if they are done, they can be done either private pay or hospitals that definitely need the testing done on behalf of their patients pay for it out of a base budget that doesn't cover all of the expenses. So recommendation number 1 out of 2 under diagnostic capacity is to have full coverage for all of the needs that we have for testing related to mild cognitive impairment and dementia. And the second one is for use of all of the available clinical diagnostic machines that we currently have to operate at full capacity to allow us to improve monitoring for patient safety relative to those with mild cognitive impairment and Alzheimer's disease. So many of you are likely following in the media, in other countries, disease-modifying drugs, Alzheimer's and dementia disease-modifying drugs are becoming available in other jurisdictions, not yet in Ontario. We are looking forward at the need to ready our system to be able to provide these to our patients, to the public, to anyone who is eligible and wishes to have these. At this time, many of those medications and tools require close monitoring, and we don't have the capacity just yet in our system. We have machines, they don't all run full time. That takes an investment of the individuals to both the technicians to run the machines and also the individuals, the radiologists to read the tests. So altogether, what we're hoping for is a recognition that we need to operate all of our system in diagnostics at full capacity in order to be able to serve the population, both now and as new tests evolve and new medications evolve in the future. So I'd like to, at this point, pass it on to my colleague, Lisa.
Great. Thanks so much, Deb. So now we're talking about care in the community, and I see that there's a number of people who are on the call today who are caring for people presumably living in the community. And the bottom line is there's not enough support in the community, and it's a huge problem. And people end up in long-term care prematurely or unnecessarily because of that. And to even get into long-term care, you have to go through the emergency department of a hospital as opposed to coming from community, which is not the way it should be. So we have two recommendations in this area. The first is to support people living with dementia and their care partners to age in their place of choosing through an increase of $80 million per year for community support interventions. So that includes a broad range of things, such as having more day programs. And the day programs that we do have, families have to have a copay for that. And we should eliminate that copay because it's a barrier. Respite care is critical so that family caregivers can get a break. They are incredibly burnt out, and although people are finally starting to recognize the importance of family caregivers, there's not enough or nearly enough support for them. And respite is one very important element of that. Social activation is another thing we saw, especially during COVID, that when people are lonely, it really has very negative health impact on them if they have dementia and if they're a caregiver or if they're anyone, in fact. So social isolation is a big problem. And so we need more funding there. And other things, including mobility, transportation. You can have all the services in the world, but if you can't get to them, and if it's icy and snowy, or you just can't walk very far, or you're in a wheelchair, you need to have transportation and other relevant technology enablers. So this is a really big ask, and there's a lot more that we could put in this paragraph, but those are some of them. And we really need to shift the focus in the system because the money is going into the hospitals, and we need to have more money go into the community, which is a much cheaper intervention. It keeps people at home and living longer. And then the next one is talking about family managed home care. So we're asking for improved access to the family managed home care program by expanding eligibility to include people living with dementia and their care partners, and simplifying administration of the program. So this is basically self-directed care, and families know best usually how to, what kind of care is required for their loved ones. And currently those with dementia, in fact, most seniors are not eligible for this, only adults with acquired brain injury. It's mostly used for the care of children with complex health needs. So we need to take this program and make it more extensive. So now we can go on to recommendation 5. Oh, and I didn't say who I was. So I'm Lisa Levin, and I'm the CEO of Advantage Ontario. And we are an association that represents most of the non-profit long-term care homes in Ontario, practically all of the municipal long-term care homes, and many hospital, if not most hospital, long-term care homes. And we also have many members, hundreds of members with housing and community support services for seniors. So hence why these topics are of great interest and to myself and our organization. So for long-term care, we're recommending a funding of $40 million per year for long-term care homes to implement critical initiatives that improve the quality of life and care for residents, including dementia care training for staff, because at least 70% of people in long-term care have a cognitive issue. And we really need to make sure that staff of all types in long-term care homes have adequate training. Emotion-focused models of care is also another really, really important area. And the government actually announced $15 million in funding towards emotion-focused models of care right before the election. And now we have to see what happens because there's an election coming up and we don't know where things will stand with government and with that announcement. I would urge all of you to look up an article by Moira Welsh online called The Fix, and it's a video that describes the butterfly model of care, which is one form of emotion-focused care. It's really hard to describe what it is to you in just a couple of minutes, but it's a transformational way to care for seniors with dementia. And it is really fantastic. And Deb Galley, who I don't know if she introduced herself either, is CEO of Baycrest, they have a great model there called Possibilities in Baycrest, which is emotion focused, and it really is fantastic. And we also have a number of our members that have this as well, but we need government to fund it so more homes can provide it. We need virtual behavioral and seniors mental health programs. More and more people are coming into dementia with very serious mental health issues and not have the capacity to support that or the knowledge. And then virtual behavioral supports is another important element, as well as funding transitions to long-term care. So now I'm going to pass you on to Adam Morrison of the Alzheimer's Society.
Thanks so much, Lisa. So I have the final recommendation from the Ontario Dementia Care Alliance, which is around medication management. So what the ODCA has recommended is that the government work with providers in the system to build software tools that enable pharmacists to work together with prescribers, so nurse practitioners, family physicians, specialists, to help identify patients who are taking potentially inappropriate drugs and to optimize their medications. We know that people living with mild cognitive impairment and dementia are often living with additional multiple chronic conditions. We know that a lot of folks do see multiple specialists. There is not always the kind of integration and sharing of resources and understanding what drugs someone might be on. And so we are encouraging the next government to work with providers on a system so there will be more integration. So when you go to the pharmacist, your pharmacist can look up all of the drugs that you are on. There is an ability to liaise with your primary care provider, where folks have a primary care provider, and to do a full review of medications as a standard, where people can be working together on your care. This is a really essential piece to make sure that everyone is on the same page in terms of medications, that people are not taking medications that may interact with each other, even if they would be individually supportive of different conditions, that when they're all working together, that they're still working on the support for everyone. In terms of supporting people to live well with dementia, to remain in the community, to be well, whether they're in a congregate setting like long-term care, retirement homes, or if they're in their own home in the community. So those are the 6 recommendations that we have right there. I know that we went through them fairly quickly. We have a lot more to say, and that's also why we've left a significant amount of time for questions. I'm going to put in the chat again all of the recommendations from the Ontario Dementia Care Alliance. There are the 6 recommendations that everyone spoke to. There's a lot more detail in the document that I've just linked to there, the PDF. It's 16 pages long. Excellent for all of you candidates on the line who are going to be knocking on doors and hearing from people who want to hear about dementia. Also excellent for everyone else from the public when you are speaking to candidates, when you're thinking about the system. The Alzheimer's Society of Ontario facilitates this group. But as you have already heard from Deb and Lisa and Laura and Kelly, this is just a small representation of the group who is on the Ontario Dementia Care Alliance and all of the expert recommendations that they did put together. So just a reminder again, thank you everyone who is sending comments in the chat and questions. We are going to address those momentarily. Please feel free to continue adding questions either in the chat or with the Q&A function. We'll do our best to get to them as well. I'm going to hand it over to my colleague Jessica for some of the resources we've talked about, a few more that we'll put in the chat as well, and then we will get to your questions. Over to you, Jessica.
Thank you, Adam. So there's a few resources on the screen here. The first one is a link to the Ontario Dementia Care Alliance resources page where you can read the recommendations. That was the link that Adam had just shared in the chat for you. The Alzheimer's Society of Ontario also has a campaign website right now called actionfordementia.ca. If you head to this website, you can download an election primer, which is basically a basics of the election, what it is, why it's important. There's also a questions for candidates document that you can download. So, you might be getting some candidates coming to your door, giving you phone calls. This is meant to be a guide on some questions related to dementia that you can ask them. Lastly, there is a link here to the Elections Ontario website where you can put in your postal code and you can find out who your candidates are and where you can go and vote. So we'll leave this information up on the screen for you while we're going through some of the questions today, just so that you have these resources, and we will also share them in the chat so that you can have easier access to these links as well.